Hey guys, welcome to this channel, Victory the Educator. Welcome, welcome, welcome. My name is Victory and I get to teach you a little something. But all jokes aside, so today, real quick, I will be talking to you about non-bedside job opportunities for nurses out there. As a nurse for over a decade, I understand, I get the burnout is real, y'all. It is real. I understand the overload of patient demand and all the documentation that just keep piling and piling, and just not having enough time in even a 12-hour shift to get everything done, and always going home kind of feeling like, there's more you could have done, or just feeling like, you didn't really do your best because you're so overloaded with so much work, and you got to answer the call like within 5 minutes or within 15 minutes. You got to do this, you got to do that, you got to document this, you have to call this, you have to do this. You're literally doing everything as a nurse except for certain exceptions, right? But as a nurse, you are housekeeping to an extent, you are pharmacy to an extent, you are phlebotomy, definitely. You are even dialysis to an extent. You are even sometimes the provider, because you have to catch things and give hints and say, hey, can we try Bumex instead of this? Like, can we try this? Just giving suggestions. And you're also just a counselor and case management and everything. So I get it. Being a nurse is heavy, especially if you are in the hospital setting or in the long-term care setting. It's a lot. Sometimes in the long-term care settings, they have up to 20 patients to one nurse, and that's on a good day. Sometimes I've seen them have like 30 patients to one nurse in a long-term care setting. I get it that the needs are not as demanding in long-term care, but people are getting sicker, right? People are getting sicker. The needs, long-term care settings, now they have them on antibiotic, on different types of medication that before wasn't a norm, okay? So with all that said, I want to get into this. If you are watching this video because you're a nurse and you're burnt out, I get you. I've been there, trust me. I stopped working bedside September 2021. That was the last time I worked bedside. I've been a hospital nurse for over a decade. That's all I know is working in the hospital, working those 12-hour shifts. I've worked 8-hour shifts in the procedural area in the cath lab. That didn't work out either. So I can tell you from my own experience that definitely once you get out of bedside, there is a sense of freedom, right? First, you have to overcome that desire to always want to work a 12-hour shift wherever you go. You're not always going to get that outside, in the non-bedside setting. And also you have to overcome that desire of the pay, right? So bedside often pays a lot better, but non-bedside, you have a lot more freedom. You can actually live a normal life, hang out with your family, all that stuff. It's just, you just kind of weigh your pros and cons. Anyway, so let's get started. So the first non-bedside job opportunities that you guys should definitely consider is being a clinical educator. A lot of people think being a clinical educator or nurse educator is limited to a facility, right? The hospital setting, or limited to a long-term care setting, but you can actually be a nurse educator, clinical educator for a medical device company, right? So that's one. Another one is actually to be a legal nurse consultant. So oftentimes legal firms will hire a legal nurse consultant to kind of go through medical paperwork, especially if that legal firm deals with medical lawsuits, right? A lot of lawsuits with malpractice or anything like that. They deal with a lot of medical lawsuits. They will need a legal nurse who is familiar with the terminology to go over the patient paperwork, the patient information, just that aspect. Okay, so that's a position you can consider. Another one to consider is a clinical specialist. So clinical specialist, you will be working with a medical device company. It is similar, if not the same. It's pretty similar as if you as a clinical educator in a medical device role. So clinical specialist, you will be let's say you work for an IV company as a clinical specialist. You will be part of the team, that's basically enhancing the experience and training the nurses and healthcare professionals in that facilities that you will introduce the new product to. So that's something you can do, so that there's a lot of meetings. I've actually talked to a clinical specialist and she loves it. A lot of the clinical specialists I know that are nurses have been there for like years. When I mean years, I'm not talking about 10 years, like 20 years and up. So they love it. They love it. Some of them still keep like a PRN job working in the ER, which they maybe go once a month or whatever, but full-time they still do their clinical specialist position. Another one to consider is actually being a nursing instructor, guys. So I have done it. I am a nursing instructor, and I can tell you firsthand, it is definitely, it's rewarding. And to be honest with you, it does have its challenges. I'm not saying it's all beds and roses. That's why I'm giving you this option so you can weigh your pros and your cons, right? So nursing instructor for, if you don't have your master's, so let's say you have your bachelor's only, you can be a nursing instructor at an LPN school, so a practical nursing program, or you can work at a CNA program, CNA CMA program, which is what I did. So I worked as a nursing instructor for a practical nursing program, for LPNs, for a couple years. So that was pretty nice. I enjoyed it. The pay was okay. The pay was decent. Let me be honest with you. The pay was decent. It wasn't bad. Of course, you always know you can make more in the hospital, but for me, I felt like I took home more, just because you work 40 hours a week. In the hospital setting, you work 36. And most of the time you're tired and you don't pick up. I was not known to pick up overtime. If I did, it was once in a blue moon. So in the education setting, you can work as a nursing instructor, get to impart into other new nurses, inspire other new nurses, and still kind of keep up with your skills because you're teaching them. So you have to know what you're doing or what you're teaching them, right? The last one also is to be a school nurse, right? School nursing is one that a lot of people overlook. I have done school nursing. I filled in for a school nurse at one time. It wasn't for me just because it was really boring. But to be honest with you, if you are a nurse that maybe has like a business or something, if you have a side business, or if you are if you have something else you're doing with school nursing, you're going to have a ton of free time, a lot of free time. So that's something you can do, still be there for the kids, still make sure they're compliant with their immunizations, their medical profile, and still kind of work on your own stuff on the side. Okay, so that's another one, guys. So I hope this is helpful. I really do. If this is helpful, please comment below. Comment in the comment section. Just let me know. Let me know if I missed one. If there's one that you one that you thought of that I didn't mention, feel free. If you've tried any of these, feel free to tell me your experience with them. Now I will have to look down. I got my list here, so let me just make sure I didn't miss anything. The other one I will say is case management is another one. I've never done case management, but I have seen a lot of positions for case management, either in the hospital setting, mostly in the hospital setting, but once in a while you do get some companies that will look for someone for case management. That's another one. So that is it, guys. Hope this was helpful. Please be honest. Hope this was helpful. I will share more videos to kind of inspire us, to push us forward as nurses. We got this, and also to give you creative ideas. Yeah, feel free to ask any comments that you have below. And until next time, God bless you. Have a wonderful rest of your week and rest of your day. Bye.